Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing articles in New England Journal of Medicine. Highly pathogenic avian influenza AH5N1 virus infections in humans. Background. Highly pathogenic avian influenza AH5N1 viruses have caused widespread infections in dairy cows and poultry in the United States, with sporadic human cases. We describe characteristics of human AH5N1 cases identified from March through October 2024 in the United States. Conclusions. In the cases identified to date, AH5N1 viruses generally caused mild illness, mostly conjunctivitis, of short duration, predominantly in U.S. adults exposed to infected animals. Most patients received prompt antiviral treatment. No evidence of human-to-human AH5N1 transmission was identified. PPE use among occupationally exposed persons was suboptimal, which suggests that additional strategies are needed to reduce exposure risk. Embolization of the middle meningeal artery for chronic subdural hematoma. Background. Patients receiving standard treatment for chronic subdural hematoma have a high risk of treatment failure. The effect of adjunctive middle meningeal artery embolization on the risk of treatment failure in this population remains unknown to see conclusions. Among patients with symptomatic chronic subdural hematoma, adjunctive middle meningeal artery embolization resulted in a lower risk of treatment failure than standard treatment alone, without resulting in an increased incidence of disabling stroke or death in the short term. Further study of longer-term safety outcomes is warranted. Oral Infigratinib therapy in children with Achondroplasia. Background. Achondroplasia is a genetic skeletal condition that results in disproportionately short stature and medical complications throughout life. Infigratinib is an orally bioavailable FGFR1/3 selective tyrosine kinase inhibitor in development for achondroplasia. Conclusions. The administration of oral infigratinib did not result in any apparent major safety signal, and increased the annualized height velocity and z-score, and decreased the upper to lower body segment ratio at 18 months of treatment in cohort 5. Next we will be discussing articles from Journal of American Medical Association First-Line Sugemalimab plus Chemotherapy for Advanced Gastric Cancer, the Gemstone 303 Randomized Clinical Trial. Question. Does adding Sugemalimab to chemotherapy improve survival for untreated advanced gastric and gastroesophageal junction adenocarcinoma, with programmed death ligand 1, PDL1, combined positive score, CPS, of 5 or more? Findings. In this randomized clinical trial of 479 patients with PDL1 CPS of 5 or more, Sugemalimab plus chemotherapy significantly prolonged overall survival, median 15.6 versus 12.6 months, and progression-free survival, median 7.6 versus 6.1 months, compared with chemotherapy alone, with a manageable safety profile. Meaning Gemstone 303 is the first trial demonstrating a statistically significant survival benefit for addition of an anti-PDL1 antibody to standard chemotherapy for advanced gastric and gastroesophageal junction adenocarcinoma. Medicaid spending and health-related social needs in the North Carolina Healthy Opportunities Pilots Program. Question. Is North Carolina Medicaid's Healthy Opportunities Pilots 1115 waiver program, which provides non-medical services to address health-related social needs associated with lower Medicaid spending? Findings. This comparative interrupted time series evaluation found that spending increased near program enrollment, followed by a significantly decreasing trend in spending relative to what would have been expected in the absence of the program. Meaning because lower need for expensive health services can indicate better health, These findings are consistent with the idea that programs to address health-related social needs may help improve health for Medicaid beneficiaries. Next, we will be discussing articles from Annals of Internal Medicine. Glucagon-like peptide 1 receptor agonists and risk for depression in older adults with type 2 diabetes, a target trial emulation study. Background. Although glucagon-like peptide 1 receptor agonists, GLP-1 RAs, have shown potential antidepressant effects, population studies yield inconsistent results. TOTS conclusion. Among older adults with T2D, the incidence of depression was relatively low. Use of GLP-1 RAs was associated with a modestly lower risk for depression compared with use of DPP-4 is, but not SGLT2 is. Next, we will be discussing articles from British Medical Journal. Glucagon-like peptide 1 receptor agonists and risk of suicidality among patients with type 2 diabetes. Active comparator, new user cohort study. Objective to determine whether the use of glucagon-like peptide 1, GLP-1, receptor agonists, is associated with an increased risk of suicidal ideation, self-harm, and suicide among patients with type 2 diabetes, compared with the use of dipeptidyl peptidase 4, DPP-4, inhibitors or sodium glucose cotransporter 2, SGLT2, inhibitors. Conclusions. In this large cohort study, the use of GLP-1 receptor agonists was not associated with an increased risk of suicidality compared with the use of DPP-4 inhibitors or SGLT2 inhibitors in patients with type 2 diabetes. Next, we will be discussing articles from Lancet. Endoscopic, ultrasound-guided, radiofrequency ablation of aldosterone-producing adenomas, Fabulous, a UK, multi-center, prospective, proof-of-concept trial. Background. Unilateral aldosterone-producing adrenal adenomas, APAs, are the potentially curable cause of 5% of all cases of hypertension. Their localization, via adrenal vein sampling, AVS, and removal, by laparoscopic adrenalectomy, require invasive procedures that are unattractive to patients. Molecular imaging located. Endoscopic ultrasound-guided transgastric radiofrequency ablation, use RFA, is a potential novel, minimally invasive alternative to AVS and total adrenalectomy for the treatment of APAs in the left adrenal gland, which is very close to the stomach. We aimed to determine whether use RFA can safely target a heterogeneous set of such tumors without damaging the rest of the adrenal gland or adjacent organs. Interpretation. Use RFA appears a safe alternative to total adrenalectomy for the treatment of left-sided APAs, and has the potential to completely cure primary aldosteronism and hypertension when most of the APA is ablated. These findings have informed the design of a pivotal study of thermal ablation versus surgery, which will determine the full benefits of US RFA. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Nodal burden and oncologic outcomes in patients with residual isolated tumor cells after neoadjuvant chemotherapy. Purpose. The nodal burden of patients with residual isolated tumor cells, ITCs, in the sentinel lymph nodes, SLNs, after neoadjuvant chemotherapy, NAC, EPN0I+, is unknown, and axillary management is not standardized. We investigated rates of additional positive lymph nodes, LNs, at axillary lymph node dissection, ALND, and oncologic outcomes in patients with EPN0I+ treated with and without ALND. Conclusion. The nodal burden in patients with EPN0I+ was low, and axillary recurrence after ALND omission was rare in patients selected for this approach. These results do not support routine ALND in all patients with EPN0I+. Here are the articles from Journal of Hepatology. Variation in intention to treat survival by MELD subtypes. All models created for end-stage liver disease are not equal. Patients with MELD scores dominated by CR have lower 1-year ITT survival compared to scores dominated by bilirubin or INR. For each of the subtypes, Females have lower 1-year ITT survival compared to males. Within the MELD-CR subtype, those with ACI were less likely to get transplanted and more likely to die than those with CKD. Here are the articles from Clinical Gastroenterology. Meta-analysis of endoscopic full-thickness resection versus endoscopic submucosal dissection for complex colorectal lesions. Background. Studies evaluating endoscopic full-thickness resection, EFTR, and endoscopic submucosal dissection, ESD, for complex colorectal lesions have shown variable results. We conducted a meta-analysis of the available data. Discussion. This meta-analysis of small studies with high heterogeneity showed that EFTR and ESD have comparable resection rates for complex colorectal lesions. EFTR is faster and has fewer complications, but it increases residual or recurrent lesions. Next, we will be discussing articles in the field of rheumatology. A randomized controlled trial of efficacy and safety of fecal microbiota transplant for preventing recurrent Clostridioides difficile infection. Background. Clostridioides difficile infection, CDI, is the most common cause of healthcare-associated infections in U.S. hospitals, with 15% to 30% of patients experiencing recurrence. The aim of our randomized, double-blind clinical trial was to assess the efficacy of capsule-delivered fecal microbiota transplant, FMT, versus placebo in reducing recurrent diarrhea and CDI recurrence. The secondary aim was FMT safety assessment. Conclusions. FMT therapy versus placebo did not reduce CDI recurrence or death at 56 days. There were no meaningful differences in adverse events between treatment groups. Next, we will be discussing articles in the field of rheumatology. A randomized controlled trial of efficacy and safety of fecal microbiota transplant for preventing recurrent Clostridioides difficile infection. Background. Clostridioides difficile infection, CDI, is the most common cause of healthcare-associated infections in U.S. hospitals, with 15% to 30% of patients experiencing recurrence. The aim of our randomized, double-blind clinical trial was to assess the efficacy of capsule-delivered fecal microbiota transplant, FMT, versus placebo in reducing recurrent diarrhea and CDI recurrence. The secondary aim was FMT safety assessment. Conclusions. FMT therapy versus placebo did not reduce CDI recurrence or death at 56 days. There were no meaningful differences in adverse events between treatment groups. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Prevalence of autoimmune diseases in patients treated with immune checkpoint inhibitors, an epidemiological study using a global network of healthcare organizations. Objective. Evaluate prevalence of new-onset auto. Conclusion. Patients receiving ECs have an increased risk of developing ACs, especially RA. There needs to be a high index of suspicion and awareness about ACs for prescribers of ECs. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Arterial lymphatic-like endothelial cells appear in hereditary hemorrhagic telangiectasia 2 and contribute to vascular leakage and arteriovenous malformations. What is new? Arterial lymphatic-like endothelial cells appear in hemorrhagic telangiectasia type 2 and contribute to arteriovenous malformations. Arterial lymphatic-like endothelial cells may be derived from ALK1, activin receptor-like kinase 1 depleted arterial endothelial cells. The derivation of arterial lymphatic-like endothelial cells was mediated by FLT4, SOC17, SRY box transcription factor 17, MDM2, mouse double-minute 2, and ProX1. What are the clinical implications? Preventing ALK1 depleted arterial endothelial cells from acquiring lymphatic endothelial characteristics would provide a new therapeutic strategy in hemorrhagic telangiectasia type 2. Here are the articles from Journals of the American College of Cardiology. Intensive Lifestyle Intervention, Cardiac Biomarkers, and Cardiovascular Outcomes in Diabetes. Look ahead Cardiac Biomarker Ancillary Study. Background: N-terminal pro-B-type natriuretic peptide, NT-promptpide, and high-sensitivity cardiac troponin T, HSCTNT, are associated with cardiovascular outcomes and are recommended for measurement in type 2 diabetes, T2D. However, the effects of an intensive lifestyle intervention, ILI, targeting weight loss on cardiac biomarkers, and the prognostic association of changes in these biomarkers with risk of adverse cardiovascular outcomes in T2D, are not well established. Objectives: this study sought to evaluate the effects of an ILI on cardiac biomarkers and the association of changes in cardiac biomarkers with risk of cardiovascular outcomes in T2DC. Conclusions: among adults with T2D, an ILI led to a significant reduction in HSCTNT on follow-up, but a transient increase in NT-promptpep levels at 1 year that attenuated over time. Longitudinal assessment of NT-prompP and HSCTNT provide prognostic information for a SCADE risk, whereas only changes in NT-prompB predicted HF risk. From JAMA Cardiology. Interpreting Population Mean Treatment Effects in the Kansas City Cardiomyopathy Questionnaire Patient-Level Meta-Analysis. Question: is a small mean treatment effect in the Kansas City Cardiomyopathy Questionnaire, KCCQ, score, less than 5 points, clinically important in patients with heart failure? Findings: in this patient-level meta-analysis of 11 randomized clinical trials, including 9,977 patients, a small difference in the mean KCCQ score between two treatment groups was associated with substantial differences in the proportions of patients experiencing clinically important changes in their health status. Meaning results of this study suggest that while statistically significant mean treatment differences in the KCCQ may be small, clinical significance should be based on the distributions of patients having clinically important benefits from treatment. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Clinical and biochemical data for the diagnosis of endogenous hypercortisolism, the Cushingomic approach. Context: the clinical presentation of Cushing syndrome, CS, overlaps with common conditions. Recommended screening tests are serum cortisol after 1 mg overnight dexamethasone suppression test, DST, urinary free cortisol, UFC, and late-night salivary cortisol, LNSC. Objective: we analyze the diagnostic accuracy of screening tests in 615 patients without CS, 263 suspected CS, 319 adrenal and 33 pituitary incidentaloma, and 40 with CS. Conclusion: despite the high diagnostic accuracy of screening tests to detect CS, cortisol-related comorbidities or A.I. should be considered when interpreting a positive test. Next we will be discussing articles in the field of neurology. Here are the articles from Neurology. Utility of progression independent of relapse activity as a trial outcome in relapsing remitting multiple sclerosis. Background and objectives: progression independent of relapse activity, PIRA, is increasingly used as a measure of disability worsening in multiple sclerosis, MS, and is believed to reflect the more chronic neurodegenerative aspect of MS. However, while conceptually appealing, PIRA and its counterpart, relapse-associated worsening, RAW, have not been validated as outcome measures for clinical trials. Here, we study the co-occurrence of MRI activity in patients experiencing PIRA and RAW in a clinical trial setting. To illustrate the problem of random variation and measurement error of these new outcomes, we contrasted PIRA and RAW with similarly defined improvement. Next we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. The responsiveness of exercise tests in COPD, a randomized controlled trial. Background: COPD is characterized by reduced exercise tolerance, and improving physical performance is an important therapeutic goal. A variety of exercise tests are commonly used to assess exercise tolerance, including laboratory and field-based tests. The responsiveness of these various tests to common COPD interventions is yet to be compared, but the results may inform test selection in clinical and research settings. Research question: what exercise test possesses the greatest sensitivity to change from before to after intervention in patients with COPD? Interpretation: the ESWT and CWRCT seemed to be the most responsive exercise test protocols to long-acting muscarinic antagonist and PR therapy. The magnitude of change was much greater after a program of rehabilitation compared with bronchodilator therapy. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Humidified non-invasive ventilation versus high-flow therapy to prevent reintubation in patients with obesity, a randomized clinical trial. Rationale: the optimal strategy to prevent reintubation in patients with obesity remains uncertain. Objectives: we aimed to determine whether non-invasive ventilation (NIV) with active humidification is superior to a high-flow nasal cannula (HFNC) in preventing reintubation in patients with obesity at intermediate risk. Conclusions: among adult critically ill patients with obesity at intermediate risk for extubation failure, the rate of reintubation was not significantly lower with NIV than with HFNC. Nevertheless, there is a risk for underpowered results. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Efficacy and safety of admilparant, an LPA1 antagonist, in pulmonary fibrosis, a Phase 2 randomized clinical trial. Rationale: idiopathic pulmonary fibrosis, IPF, and progressive pulmonary fibrosis, PPF, have high morbidity and mortality. Thus, novel treatments are needed. Objectives: assess efficacy and safety of admilparant, BMS 986278, an oral lysophosphatidic acid receptor 1 antagonist, in patients with IPF and PPF. Conclusions: in this first Phase 2 study to evaluate antifibrotic treatment in parallel IPF and PPF cohorts, 60 mg admilparant slowed lung function decline and was safe and well tolerated, supporting further evaluation in Phase 3 trials. Here are the articles from Kidney International Reports. Impact of different CKD definitions on long-term renal function and mortality in a population-based cohort study. Introduction. The adoption of age or individualized body surface area, IBSA, estimated glomerular filtration rate, EEGFR, thresholds could influence the prevalence and prognosis of chronic kidney disease, CKD. This longitudinal study, with up to 15 years of follow-up in the general population, compares different eGFR thresholds for CKD definition, standard, corrected to IBSA, and age stratified. For each, we assessed the prevalence of CKD and the combined impact on rapid renal function decline, RRFD, and mortality. Conclusion. In our study, classification of CKD by age or IBSA does not appear to improve prediction of RRFD and mortality.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.